What's your experience of treating patients with alcoholism?
So I've been a GP now for 30 years, and over that time, I've treated many patients with alcohol problems. In the early years, the involvement of the GP was much more substantial before the setup of drug and alcohol groups provided by the NHS. Drug and alcohol services, over the last few years, it's been a lot more difficult to access those services, and sometimes there's considerable delays in accessing those services. Originally, in the 1990s and in the early 20s, we would be able to do a detox at home using tablets that are available in general practice. But now, generally, drug and alcohol services recommend that they want to manage those issues, which makes it somewhat more difficult for patients. We always encourage them to access services through drug and alcohol, but I like to monitor those patients. The alcohol will cause significant physical problems, significant mental health problems, significant social problems, marital problems, and patients can benefit from seeing their GPs for a lot of these issues. And the services that GPs provide are effective. Sometimes for patients, it may be just a respite, temporary respite, that for a few months they're not drinking, then they go back to their drinking habits. We've got Alcoholics Anonymous and other organizations that focus on alcoholism.
Do you find there's different stages of alcoholism? There's certain stages where this person's too far gone and we no longer can treat them as we would treat with someone who's just been taking the odd drink here or there.
I don't think anyone's ever too far gone, because even if you can encourage them to stop drinking for a few months, which often you can with a little bit of help, that will give their body a little bit of a respite. There'll be some recovery of their liver function.